Life. It can certainly take a toll on our bodies. Whether it's due to the aging process or the rigors of competition, at some point, most Americans will experience pain of some sort. Pain can make simple daily activities difficult and unpleasant. When pain becomes long-term pain, it can dramatically change a person's quality of life.
The International Association of the Study of Pain defines it as an experience, a subjective experience. So that incorporates a lot of the different things that are taking place in a patient's life at that time. Stress levels, home environment, work environment, things like that. It can be a real injury, it can be the potential for injury. It could last from a couple of minutes to a lifetime. And that's where the definition diverges between acute and chronic pain. The difference between acute and chronic pain is going to be the duration of how long it's lasting for that patient. Acute pain typically represents an immediate pain all the way up to about 3 months. Some sources say 6 months, but typically 3 months is what we utilize. Chronic pain is after that, anything after 3 to 6 months, and that can be up to a year, it can be a lifetime of pain. Everyone's experience with pain is going to be different, and that takes into consideration what's going on in their life at that time, kind of what their coping strategies are and what their support structures are. A lot of that factors into how people experience pain and what we can and cannot do to help them.
When you talk about the musculoskeletal system wearing out, usually you're talking about an adult or an older patient. The joints that we see the most common are going to be knees and hips, but also shoulders, ankles, really almost any joint. Some people have an old injury, they might have an old infection, some of it's probably genetic, or maybe they've been overweight, and all of that plays a role. The most important thing for people is to see what they're looking for, what do they need help with, what are their goals. People that are still working might not be able to do their job because of their pain, and people that aren't working may not be able to enjoy their retirement. The most important thing is taking the time to listen, see what their goals are, and usually we can help them get there.
So the first and best thing that we do here at OSMC is we listen to the patient. In my practice, we use non-invasive or minimally invasive techniques to help with pain, such as injections or minor outpatient procedures or surgeries, and that tends to get people back on track with their pain. So after you've exhausted some of the more non-invasive techniques, you can then move on to a little bit more invasive, such as injection therapy, to help people that have disc problems or sciatica, or if they have arthritis pain. When the more conservative treatment measures like physical therapy or anti-inflammatories stop working, then you start looking at whether or not it's appropriate to have a total joint replacement, because not everybody is a candidate for a total joint replacement, but when they are, they do help people quite a bit.
There isn't a one-size-fits-all approach for treating orthopedic or chronic pain conditions. When medication, physical therapy, and other treatment options fail to provide relief, in many instances, joint replacement surgery can work well for individuals. Choosing an experienced orthopedic surgeon who will offer the right surgical technique for the patient's specific need is critical to achieving good outcomes.
As a surgeon, you have to be a student the rest of your life, and you have to keep learning, and you have to engage in new technology that's out there. ROSA is a robotic surgical assistant that allows us to give you a very tailored, custom, precise implant as a patient, and it allows us to match your natural knee with a prosthetic knee and give you the best outcome in the long term. What we're seeing is we're trying to do things in smaller incisions with less and less damage to your tissues. Because of the technology surrounding how we do these things is making it less painful, we can make easier recovery, and we can make it less invasive. 84% of the patients that I do at the hospital go home the same day, within 3 to 4 hours maximum. At the surgery center, I'm 100%.
It is possible for those suffering from pain due to an injury, overuse, or arthritis to get back to regular activity with the right care team and treatment plan.
So I've been here for 18 years, and from the first time I started, there was this phrase of do the right thing right. And I really feel like that is what we have done ever since I've been here. We try to take the time to listen to the person, see what their problem is. Yes, look at their imaging, but also do an exam and then come up with a plan that they also are on board with and agree with. I think do the right thing right really summarizes what we do, and we do the right thing for all of our customers, so not just the patients, but referring physicians, companies, and even our own staff. We take that seriously and try to treat people in the right way.
The Orthopedic and Sports Medicine Center of Northern Indiana has provided comprehensive care to Michiana for 50 years. with 25 physicians and advanced practice providers. The skilled, fellowship-trained doctors and professionals offer surgical and non-surgical options, physical therapy, pain management, podiatry, care for sports injuries and on-the-job injuries. And 6 locations make it convenient.
OSMC does have a unique way in which we take care of our patients and customers. When we recruit new physicians, we have to make sure they're the right fit and that they buy in to the type of care that we provide. We feel like if we do the right thing by our customers and our patients, that the financial side of the business will actually take care of itself. Moving forward, I think there's just going to be continued commitment to that culture and to the way that we care for people.
Bones, joints, muscles, and more. OSMC can help keep your family moving. OSMC is the way to care. Make an appointment via phone or online today.